Hey guys, welcome back to my channel. My name is Ruth. If you're new to my channel, and I just want to say thanks so much to my viewers and subscribers. I've been away for a little while, but I noticed I even got a little more subscribers. So I say thank you so much to all of you newbies to my channel. Well, today I'm going to talk about how to work safely with patients with COVID-19. As some of you know, if you've been on my channel before, I started to work as a nurse extern for these past few months during the summer, and it has been an amazing experience. And I have been able to work firsthand with patients with COVID-19. Pretty much every week, I'm assigned to work with patients with COVID-19. Like I'm on an entire unit that has patients with COVID-19. And sometimes I do have some units that don't have many COVID patients, but there'll be one or two along that do have COVID, and I have to take care of them and patients with, that are there for other purposes. So with COVID coming back again, like we're getting more numbers within the US area. um I thought I should make a video on how we all as healthcare workers can at least work safely, because this thing doesn't seem to be going away anytime soon. So how can we still maintain our job and still be happy doing it and still stay safe as much as we can? So if you're interested in getting to know what I do to work safely as possible, or what I have been doing for the past 2 months since I started, stay with me, okay? So the most important way, or the most important thing to do to stay safe while working with patients with COVID-19 is to wear your PPEs. What are your PPEs? They are your personal protective equipments, and those include wearing gloves, wearing an N95 mask, wearing your gown, your face shield, and if your facility provides a hair cover and a shoe cover, you use those as well. So those are things that I have been using, and it's not just saying that you will use it, but actually using it at all times when you enter a patient's room. That's the most important thing, because you could wear it one time and then you forgot, or maybe wear it all throughout it, pretty much all throughout your shift, and then maybe that one time you let your guard down. This COVID-19 only requires maybe one brief contact with someone who has it, and that's it. So we don't want to be taking chances. So the best way to protect yourself is constantly reminding yourself, make it a mental thing, or like a dialogue with yourself in your head. You constantly remind yourself, once you enter the hospital or the whatever nursing home or wherever you work, remind yourself that you need to wear your mask, especially when you have patients that have been diagnosed of COVID-19. um like I said, I've been working on units with patients that have COVID. So it's something that you have to wear all throughout the night pretty much, and sometimes you feel kind of like stuff in it. You can breathe that much, and you will feel like, oh, maybe let me take it out a little bit to breathe out, which is normal when you're not in the patient room. That's a normal tendency for most healthcare workers, including myself. So we need to try to remind ourselves, when you're going back into that patient's room, to put on your N95 back on, because you need it. You need that face shield, because COVID has a droplet factor with it. So the patient might be coughing. You have to protect yourself from that, because that's how you could contact the virus as well. So yeah, like I said, your gloves. If you don't wear anything else, wear your masks, your N95 masks, not just any masks for patients with COVID-19. You wear your face shield, especially if the patient's coughing or whatever like that. You need to have your face shield on, and when you're touching a patient, especially with the nature of my job, I do touch the patients a lot. I need to provide personal care for them, so I do get to touch them a lot. I try to remind myself to always wear my glove, and now it has become a part of me that I don't just wear a single glove, especially depending on what I'm doing, what kind of care I'm providing for the patient. I will wear like 2, 3 gloves depending on what I'm doing for the patient. So we have to be efficient about it. We don't want to let our guard down. And talking about letting guard down, I'll also chip in something concerning patients who we think do not have COVID, or who have not been tested for COVID, or we do know their COVID status. We don't want to let our guard down for those patients as well, because um, I have worked with some patients like throughout my shift, and then maybe later on they come back with, because maybe they are there for like a normal procedure and it's supposed to go in for like a surgery or whatever like that. The hospital will run a COVID test on them before their procedure. And that patient that you thought did not have COVID and did not even show any symptom of COVID may be reported as COVID positive. And you have already had contact with this patient. So even if you're with a patient who does not have a COVID result yet or whatever like that, even if you don't wear N95 masks, try to have some kind of surgical mask with you, please. That's what I've been doing, and what I even do when I've made it a habit of wearing doubling my surgical mask. I don't just wear a single mask when I'm working with patients who are like, oh, they don't have COVID. I still wear double surgical masks just to stay safe whenever I'm entering a patient's room. So that's how I've been doing so far for the past almost 2 months or 2 months or so, to stay safe. And another thing I like to say, even when you are in contact with fellow healthcare workers, please try to wear your N95 mask, because every healthcare worker may not be working as safely as you do, because some people do not like the mask. Let me be frank with you. Some associates do not like to wear the mask. They probably have more difficulty breathing with it, and so they might not always use the mask when with their patient. And now you think you all are healthcare workers, you all are healthy there working, and you come in contact with them maybe in the break room and stuff like that, or maybe in at the end of your shift when you're giving report to them. Try to wear your mask when you're close to them. What I like to tell myself is, I view myself and every healthcare worker and every patient, whether they are COVID positive or not, as we all have a potential of coming down with this virus. No one is immune to it, so we need to try our best to protect ourselves. And most of all, what I do is I pray for safety. When I'm going to work, I pray for safety. I pray to God to give me the ability to do those things that I have just mentioned. Remind myself to wear my mask and work as safely as possible while providing my patients the care they deserve. So yeah, it was just a video I had to put out there for us, because like I said, this virus is getting even more, and we do need healthcare workers. Some people have, because of the since the outbreak, some healthcare workers have either reduced their hours of work to stay safe, or they have left their job because that may sound extreme, but I do know some people who have some immune disorders and stuff that make them more susceptible to the virus, and they had to like leave for their safety. Yeah. But if you have relative health and you're just afraid to go out there and work in a health care sector because of this virus, there is a possibility that you can work safely if you use those things I just made mention of. It's not 100% guarantee. You need God's guidance and protection. Plus, you need to implement those things, and you'll be able to hopefully work safely. Alrighty, guys, let me not make this video too long. I love you guys so much. I have missed talking to you all, and that's why I came back.